Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Look, don't fall into this trap. There's an unintentional trap of thinking that the DBQ is going to help you with everything with your claim. And if you could just get your doctor to complete the DBQ, that you're going to be golden. And the answer is no. Can it help? Yes, but I'm going to dive into this a little bit to you and explain to you why I am warning you on just submitting whatever you get from your doctor with your DBQ and doing little footwork. So with that, please hit the thumbs up, subscribe, share with a friend, and look, if you're not a member, consider joining. It helps the channel, and getting that icon next to your name allows me to find you quicker in the comments so I can respond to you. I do my best, but with how many videos I put out, it's impossible for me to respond to everybody's comments. So I rely on the community to help answer questions as well. So anyway, let's jump into it. The DBQ is a great form. It really is. But it's a form like any other form, and it is a VA form, and it helps to structure everything regarding your condition for the VA to easily digest and understand where your rating should be. It's not necessarily a form to diagnose you. It's a form for the VA, again, to understand how severe your ratings are. And I'm going to give a good example here in a little bit, and I'm going to use GERD as the example and show you how you could go from a potentially a 0 or a 10% to a 60% with that form, right? So it can be anything, and I'm going to teach you or show you how to get around that. So do you need a DBQ is one of the first questions that I'll hear. Do I need to go get a DBQ for this condition? Do I need to go get a disability questionnaire completed by my primary doctor for this condition? And the answer is no, you don't. You can do exactly the same thing that a DBQ will accomplish by being smart and informing your doctor and having them put information into your medical records, and I'll explain that as well. But again, does the DBQ help? Sure. Again, it puts everything in a nice, orderly fashion for the VA, specifically the Veterans Benefits Administration, VBA, puts it in a nice, structured format on a form that they know to help them give you the appropriate rating. But like any form, garbage in is garbage out. So you, as the veteran, in my opinion, look, here's me. If I were to file a claim today for GERD, what I would do, and GERD, for those that don't know, really super bad heartburn, gastroesophageal reflux disease. If you have heartburn, you may have GERD, and you might want to get tested for it or go get diagnosed for it. And a side note here, and everybody who watches my videos know that I go off on little side roads for a minute. Here's the little kind of public service announcement, I guess, in this video is for things like GERD and migraines, oftentimes the patient doesn't go get diagnosed for those, right? You just self-medicate. You take a bunch of Tums, or you take, Advil or Motrin or whatever, an aspirin, and you deal with your migraine or you deal with your GERD, and you move on. So there's a higher probability of being able to link that back to your time in service because you weren't going to get diagnosed while you were serving, right? So this gives you the opportunity to get the buddy statements, write your own statement, have a spouse or other family member that knew you and could attest to you first developing those conditions while you were in service, and you'd have a decent leg to stand on to get an approval for a service connection. Okay, so that's that piece. Now let's move on. So with the DBQ, it puts it in a nice package, right, for the VA. So do I suggest getting one when you can? Of course, it's a great thing. But if your doctor is kind of against it, or they don't feel like it, or you're getting a little pushback, it's not the end of the world. What the DBQ is doing is essentially asking questions of your primary or whatever doctor, of a doctor, medical professional, asking questions of that medical professional for a specific condition or on a specific condition to align with what the VA is looking for in the schedule of ratings. So instead of the VA saying, hey, here's the schedule of ratings, which one does the patient most likely represent? They don't do that. What they do is they ask questions to give answers that then would correlate back to the schedule of ratings. So you, as the veteran, should, if it were me, filing for GERD, for example, or for an increase or for whatever, right? Increase, secondary, first condition, whatever you have. What I would do is I would pull up the schedule of ratings. And in that, you're going to read each one of the characteristics for each one of the ratings, okay? Now, for GERD specifically, and there's some of these words that I'm not very good with saying, so we'll see if I can get through this. So, a 10% rating in the schedule of ratings for GERD is the veteran has 2 or more symptoms of the 30% rating but less severe. So that's the 10% rating. So 30%, right? So 2 of the 30%, the most common things that are going to be stated by the veteran in the 30% rating would be maybe they're going to mention heartburn, which is a symptom of GERD, and maybe they're going to mention regurgitation. So now that they've mentioned those 2 things, that's 2 of the 10% rating, right? So if you have those 2 things, then you're at 10%. Now, if you read the 30%, the veteran experiences persistent, recurrent epigastric distress with dysphagia, pyrosis, and regurgitation. Now, if you don't know the words, copy and paste them into Google and find out what they really mean. So one of them is like difficulty swallowing, and the other is heartburn. So if you have difficulty swallowing, you have heartburn, you have regurgitation, and you have substernal or arm and shoulder pain, and that it's productive of considerable impairment to your health, that is a 30%. Now that last part, that considerable impairment of health, is yes, it always is, right? Because GERD is acids coming up and eroding your esophagus, which could lead to cancer there. So yes, could be a considerable impairment of health. So that is 30%. When you move to the 60% rating for GERD, it states this is what the VA is looking for, right? So don't veer off on the sides. It's telling you right here what they're looking for. The veteran experiences pain, vomiting, material weight loss, and I'm going to say the human words instead of the medical ones here. Blood and vomit, blood and stool with moderate anemia, or other symptoms, or other symptom combinations productive of severe impairment of health. So again, to me, the potential of cancer in your esophagus, right, would be a severe impairment. It would be productive of severe impairment of health. So that's a yes, right? So there you go for 10, 30, and 60%. Now that is the schedule of ratings. So now you have 2 choices, right? You could have your doctor complete the DBQ, but if you don't tell the doctor, hey, look, I meet this 60% rating, or I meet this 30% rating, and I want to make sure that all this information gets put in here, the doctor's just going to put whatever they think, and they're going to leave out a few words. So remember, if you're a 30% rating, if you should be a 30% rating, but the doctor only puts down 2 or 3 of the symptoms of the 30% rating, well, now guess what? You're not a 30% rating. You're a 10 because your DBQ wasn't completed correctly. So make sure that you copy and paste this, print it out, take it with you to your doctor if you have them filling out a DBQ for you. And if you're sitting there with them, then you can talk to them about it. And if they want to fill it out for you and give it to you in 2 weeks, then make a little note that says, hey, I want to make sure that all these things that I have are actually put into this form. You're the patient, you know what you're experiencing more than anybody. So make sure that you get it annotated correctly. Now, if you have a doctor that says, no, I'm not going to do a DBQ, or I don't do those, or whatever, they give you some sort of pushback, then just do the same thing. Take the snippet, right? Take that piece out, copy it, print it, whatever. Take it with you to the doctor's office and say, I want to make sure that all of this information is placed into my notes regarding my signs and symptoms, right? The things that I'm experiencing with this condition. This can be done with every single condition that's listed in the rating schedule, right? So you can make sure that that information gets placed into your medical file, so that way when you get your medical files to submit with your claim, now you have it documented and it's undisputable that you would be rated, in this case, a 30% rating because you have all of the pieces in there. Now the key is when you go to your C&P exam, do the same thing. Take it with you, right? Nobody's going to care more about you getting rated with the VA appropriately than you. So take it with you. Say, hey, C&P examiner, yeah, this is really important to me. I just want to make sure that I don't miss anything. And read it off to them. You can even give it to them at the end and say, I just want to make sure that you really document all of the things that I'm experiencing with this condition. I took the liberty of writing it down for you, and for me, so I wouldn't forget. Here you go. And give it to them, and hopefully that makes it into the C&P exam. And then you're getting it from two different angles, from your doctor that has it all and the C&P examiner saying it too. Now it's going to the VA rater, who's then going to read it and go, guess what? You meet all of the criteria for a 30%. Here you go. So do you need a DBQ? No. If you do a DBQ, make sure you get the right information put into it, because a DBQ with garbage in is going to be a garbage out situation. So with that, we'll go ahead and conclude it there. Thanks so much for watching. I appreciate you. And remember, if we don't take care of each other, something went wrong.